Dr. Brandon Crawford, welcome to the Fieldswell Podcast.
Thanks for having me. I really appreciate it.
It's my pleasure. So, you are a global leader in functional neurology and photobiomodulation, which is a big word. And from what I understand, is that that is light therapy for individuals who aren't super familiar. And we're going to get into that on a much deeper level in this episode. You're known for your groundbreaking work with brain injuries and neurodevelopmental disorders. And this is a personal episode for me because I personally experienced a brain injury. I don't know if
Right.
you're super familiar with my story, but I'm really excited and have been looking forward to our combo for a long time
Mhm.
because laser therapy for healing my neurological symptoms is something that I have yet to dive into. And so I couldn't imagine a better guest to have on the show to really learn more about your offerings and what's possible with healing through light.
Absolutely. Happy to get into it. I've lasered a lot of brains.
So, to start, I think my biggest question for you is what originally sparked your passion for brain health and neurology?
So, my original idea was I was going to be a neurosurgeon. I've always had this interest in the brain, right? And so I had this path of going into neurosurgery, but then that changed whenever I got married. And I looked at statistics of divorce rates in surgeons. Um, So, yeah, that kinda, derailed my
Right.
idea of being a surgeon, but I had also always worked in the pharmacy growing up, so I was a pharmacy technician, and I, compounded different pharmaceuticals, and then I worked in the hospice, doing that, and so I got accepted to pharmacy school. Again, I'm a Texas guy, so I was in a field hunting one day, actually, and I was trying to determine which one of these pharmacy schools to go to. So I was actually praying about it, and literally in my head, like I hear a voice that says, "You're not going to pharmacy school." And so it just about knocked me over. From there, I didn't really know what I wanted to do. I stayed in a moldy house like 2 weeks ago. It was an Airbnb and totally got catfished on this thing. It was a nice house via the pictures. But when I showed up, there was like mold everywhere. So I'm still,
No way. You're still recovering. Yeah, it's scary. And there are people
seriously.
who live in homes with mold for years without realizing it, and it causes like life altering health issues.
Absolutely. And side note, we were one of those, families. We had 4 miscarriages while we lived in a house with
Oh my
mold
gosh.
that we had no idea was present until we, really started testing and uncovered it. But that's why I'm so sensitive to it because I did live in a house like that for about a year. It totally ramified my microglia and my immune system. And so now, if I walk into a place, even for a short period of time, I'm pretty reactive to it. So, yep. So sorry about that. Still recovering. But anyway, so I got this message, sent to me from above, and it really made me start to question, what am I doing? Why am I doing it? And it led me down the path of physical medicine. And so it actually got me interested in the profession of chiropractic. Now, interestingly, I knew that I wasn't going to practice traditional chiropractic like what you think of. But I knew that that line of academia had really great anatomy. They actually have really great neurology. And I love just the idea of studying the human body and how it moves, right? And so I went into that path, right, and went to chiropractic school. My first semester there was an impromptu lecture by the president of the Functional Neurology Board. His name was Dr. John D'Onofrio. And at this point, I had no idea what functional neurology was. And it's still a young profession. So even back then, this was, even younger. And I heard him lecture about how physical receptors can change brain activation and brain states. And I just completely fell in love with it. And I went up, after the lecture, I said, "Look, you don't know me, I don't know you, but this is exactly what I'm on this earth to do." Is something in this functional neurology field. So he took me in, he became my mentor, and literally I started learning functional neurology from like one of the top experts in the world, my first semester there. So I consider myself a functional neurology purist. I love things all neurology. I love functional neurology, and I love the concept of how we can activate physical receptors and really start to change brain function and brain activation.
Yeah, so incredible. And how like a chance encounter of meeting one individual can really set you on a totally different path and highlight what it is that you have a desire to do. And so what we're going to get into here is how cells communicate through light. Is that correct? And that's a big part of the work that you do is through laser and light therapy to initiate change in your clients for healing or different conditions that they come presenting you with.
Absolutely. My other huge interest was always this concept of light. Going back to my roots, like I said, I'm very faith-based. And I remember listening to, in church one day and understanding the concept that God created light before he created life. And so at an early age, I just had this concept in my head that light preceded life. Therefore, it must be very important. And I'm talking about like early age. Like I was a kid thinking about this stuff. I actually had a chest reconstructive surgery when I was in middle school. And I remember my parents were like, "What do you want after the surgery? We'll get you anything. We'll get you a video game. Well, what is it?" And I was like, "I want a laser." And they were like, "What?" And I'm like, "Yeah, I want a laser, like, that's what I want." And so they got me, like, one of those little pen light lasers, for after my surgery. I'm just a weird kid, but that's always been my interest. And then funny enough, as I'm working with Dr. John D'Onofrio, as an intern, we started seeing these complex cases. One of them was a pediatric genetic brain disorder. And I remember, talking to him and saying, "What the heck are we doing here? Like, why are we working with this case? What are we going to do?" And he said, "Look, Brandon, we're going to use laser therapy. We're going to use it on this kid's brain and we're going to see changes." And this was, again, back when this was not really done, right? There wasn't a lot being studied at this point in time, definitely not a lot of clinical evidence. And we did. And I remember watching the kid change just over time and how they developed in ways that they shouldn't. And that's when these two huge loves of mine just really merged together. And I thought, look, this is huge. We need to be using laser therapy on the brain, like for almost every case that I'm working with. And so, going to your question about, cells communicating with light, that's actually a huge concept to unpack, right? So a lot of this goes into Fritz Pops's work, where we understand and we know that biophotons are a thing. But we have to understand that these biophotons are being used as a form of communication uh, within us, but then also from our mitochondrial DNA to our nuclear DNA, right? And that's really important. I don't know how deep we want to get into this, but I do have some theories and some concepts in this realm, because our mitochondria, they produce water. They produce exclusion zone water, right? That exclusion zone water is really important. It insulates our electron transport chain. Most people understand that this exclusion zone water is what we call structured, so it actually has an electric charge. But we also need to understand that water carries a resonance. Okay. And so that mitochondrial DNA is actually passed on from our mother, right? It's strictly from our mother. And I've always kind of wrestled with that, right? I'm like, why would our species develop this system to where we're only getting this part of our, DNA, this mitochondrial DNA from the mom? Why not throw dad into the mix here? That's what we do for our nuclear DNA. And then it occurred to me, okay, there's a trauma response in that mitochondrial DNA, which is then being passed on into the resonance of this exclusion zone water. Okay. And so I thought, okay, so if we're excluding dad here, we're eliminating half of the equation on a potential trauma response. Okay, that makes sense to me. And then it really started to make sense to me when I understood or better understood Fritz Pops's work and the understanding and the concept where the mitochondrial DNA talks to our nuclear DNA by the use of biophotons. So our mitochondrial DNA is literally producing photons to communicate to our nuclear DNA to then create our genetic expression and our phenotypes. So this is where it just gets really interesting. This is a big reason why one of the lasers I created actually has a 975 nanometer laser, because the peak absorption of water in our cells is 975 to 980 nanometers. And so I want to restructure that trauma response in the mitochondria and change how the mitochondrial DNA is actually talking to our nuclear DNA. Not to mention, from all the non-native EMF, all the Wi-Fi, all the junk stuff, in our world is drying up our ability to produce exclusion zone water, which is a problem in and of itself.
Incredible. I mean, so talk to us about what are some of the conditions or the symptoms clients come into you with, and how you then select which laser you use on them and results you've seen from that work. Maybe some miracle cases that we'd be blown away by.
Well, when people ask me like, "What do you treat?" I just tell them we treat complex neurological disorders of all types. I'm pretty well known for brain injury, pediatric brain injury. My fellowship is in childhood neurodevelopmental disorders, and so I see a lot of autism and various types of neurodevelopmental disorders. I'm really loving working with seizure disorders, and honestly, I never actually set out to treat specifically seizure disorders. It really just kind of happened because of our success with that diagnosis. Basically, what was happening is people, specifically with brain injury, would be coming in and they would typically have some type of seizure presentation as well. So, what do? We do our exam, we start rehabbing the system, we start using photobiomodulation and all the different things that we do to support neuroplasticity. And people start reporting back, hey, my seizures are a lot less or gone, right? And so after hearing this time and time again, I started going, okay, apparently what we do is helping seizures. And so really started dialing in what that was. And there are some key systems that we like to work with and make sure that they're fully online when it comes to seizure disorders. And that's the trigeminal system and the vagal system, but then also just integrating the brain in general. But the use of photobiomodulation in these types of patients is very interesting. So you talked about how do you select the wavelength for different pathologies or different conditions or whatever. Seizures is a really good one to talk about here because what I've noticed clinically, gosh, for over 16 years, is that what I want to do is I want to start with a longer wavelength with these individuals and then gradually move them into the shorter wavelengths. We want to do that because the shorter the wavelength, the more energy there is per photon, right? So we're hitting them with a lot higher energy if we're using those shorter wavelengths. When I say shorter wavelengths, I mean red, violet, green, those types of colors. Longer wavelengths being the invisible ones like near infrared, mid infrared, far infrared, that kind of stuff. This was another reason why I really like my 975 nanometer wavelength because it is a longer wavelength, which carries a lower energy photon, and you're much less likely to cause seizure flares in this population. And so you start with that lower energy photon and you gradually move them into a higher energy photon.
And how many consecutive treatments do you normally see patients for? Is that case by case depending on what they're presenting with?
It is. Everything that we do is designed to increase and promote positive neuroplasticity. So, neuroplasticity, we have to think about it kind of like working out our muscles in the gym. So, if I go and do some bicep curls once a month, I'm probably not going to see great results from that. Um, Same thing with the brain, right? If I want to create real sustainable change, then I need to have adequate frequency, intensity, and duration of stimulus. And so I created this intensive care program, and it's designed around this concept of neuroplasticity. And so when someone engages with us, initially, it will be typically in that intensive care model where they're actually spending about 18 hours in a week with us. And now, depending on what's going on, that individual may be here for a week. They might be here for multiple weeks. In really severe cases, they'll be here for longer, but it really just kind of varies at that point in time. Now, at the end of that, we will create a home care plan. We'll say, look, here's what we've been working on you thus far. Here's this plan is going to carry you out, another 3 to 6 months. At that point, we'll follow up, we'll reevaluate, we'll change the home care, whatever it is, so that the treatment doesn't stop there. There's a continuation based on home care therapies.
For our listeners who aren't super familiar with neuroplasticity, the way that I understand that, and I'd love for you to give us a better definition, is the forming of new neural pathways, our brain's ability to heal, to change, to adapt through the new usage of whether we're saying laser therapy or new experiences. Can you share a little bit more about neuroplasticity for our listeners so they can understand exactly what we're referring to here?
Essentially, it's the ability of the brain to mold and change. I think what we really need to understand is that no matter what, your brain is constantly on a moment by moment basis undergoing neuroplastic change. And that can be what I refer to as negative neuroplasticity, or it can be positive neuroplasticity. So, let's say, just in a simple example, you wake up every morning and you think, oh my gosh, I got to go to work again. I hate this coworker and I don't like this. And you start in on, the negative aspects of your day. Yeah, you are plastically remodeling your brain on a daily basis, specifically your reticular activating system, to literally look for all of those negative things. So you're creating a negative mind. You're creating dopamine issues. You're creating prefrontal lobe issues, right? So even that involves neuroplasticity, and you can have a positive neuroplastic impact on your brain literally by actively engaging in a different process. So neuroplasticity is a real thing. No matter what you're doing, you are actively engaging in neuroplasticity every single day, every single moment.
I love this. And it's so funny because I always say, like, focus on what you want, not what you don't want. When we wake up, dreading this day, so much work I have to do. Oh no, what if this happens? It's almost like you're asking that to happen. You're programming your brain to look for the things that could go wrong instead of saying today's going to be an amazing day. I can't wait for all the people that I'm going to help, all the opportunities that are going to present themselves. And you really are wiring and conditioning your brain for what it is you want to see and attract into your life.
Yes. And there's multiple ways to think about this. I think if we boil it down to like the science component, like the neuroscience component, it really revolves around the reticular activating system. And this system acts as a filter subconsciously. And so if you're actively, consciously engaging in all of these negative things, like I don't like this, I can't stand this, etc., your reticular activating system is then primed subconsciously to engage in those things versus your conscious engagement of this is what I want, this is what I'm seeking today, etc. You are then setting in motion your subconscious reticular activating system to then be filtering your world and engaging in those things. So that's like the neuroscience component of it, but of course it goes beyond that in many different ways.
I'm sure there are clients who come to see you who maybe have been told there's no solution or no cure to whatever they're presenting with, or perhaps other doctors wanted to medicate them or do surgery. And that's what I love so much about your approach is the healing through light, healing through laser therapy. And I'm sure a lot of the work that you also do with your clients is helping them form a belief system that this is going to work for them. This is going to help them because I believe that does contribute.
It does. It very much does, actually. That's why we trademark the term never accept never. Even when someone is sitting in front of that authority figure, they are told, you can't, you won't, this will never happen, etc. Like that has a high degree of magnitude on that person's healing trajectory. Right now, I understand. Right, I'm a clinician. I get it. Like we do have a level of responsibility to deliver facts. Okay, or maybe not facts, to deliver probabilities, right? To deliver what we know based on research, based on whatever, right? Yes, we have an obligation to bring that to the patient, right? However, I think that we should also have an obligation to understand and be able to let them know that there may be different paths forward, right? Like even, I mean, a great example is baby Millie's story, right? Baby Millie was brought to me. She was diagnosed with alobar holoprosencephaly, which is not a great diagnosis to receive. So they were told to go home and prepare for death. They were told start with hospice care. There's nothing you can do, etc. And look, I get it. When you look at the statistics, that's what they say. So I understand the doctors telling them that. But what I don't understand is when you actually take a step back and look at Millie, right? You look at her and she is different. And when I looked at her MRI, sure, there was a lot of the brain missing. I get it. Yes, but her brainstem was intact. Her cerebellum was intact. Her vestibular apparatus was intact. She had the foundation. And Millie was definitely not struggling to survive. She was trying to thrive. I'll just put it that way. Right. So when you actually kind of take a step back and you say, okay, I understand statistics and I understand, all of this, but look at this patient in front of me. That doesn't fit the mold. Right. So that sometimes is hard for a practicing physician to be able to do, and that's exactly what we did, right? When I saw Millie for the first time, I was like, "Look, I understand this diagnosis, I get it, but here's what I see, and I'm willing to walk in this with you if you're willing to engage." Have no idea what this is going to look like. I was very upfront about that, and now look at her. She's, we're working on crawling. She's vocalizing. She's saying words. She's doing things that kids with this diagnosis just doesn't do, and it's just because we gave her a chance.
Totally, totally. And I think oftentimes in the medical system or in doctors' offices, it can feel just you're like on the conveyor belt. And with you, it really is a personalized approach. You have this care, this optimism, this hope. And I think your clients can feel that. And I think it's a big contributor to your work. Is this the machine, the laser therapy machine that you use? Do you have numerous machines? Did you develop the specific one that you use with your clients?
So yes, I've developed the 528 Innovations line of lasers that took 15 plus years at that point in time that I had in clinical knowledge and all the wish list items that I wanted out of a laser. Do we do other things? Absolutely. I have a whole litany of different modalities and things that we like to use. This is why I love. I do love the biohacking space, right? Because I'll go there and it's like, look. I love the arc bed. I love that it's like I can use that clinically too, right? So I've got clinical tools, and I even reach into the biohacking space to help my patients.
I actually was listening to an episode you did with Dave Asprey, the quote unquote father of biohacking. And it was talking about using the lasers. Say you didn't come in with a brain injury or any other disorder, you just wanted to like access higher levels of consciousness. Is that something that you see clients for as well, or that you recommend the laser for?
That's definitely something that I don't have the clinical bandwidth to engage with someone like that. My day is too busy working with patients like Millie. I think it would be cool, and I'm thinking about expanding. Maybe if my wife will let me, I don't know, and starting to do more of those optimization type of things. But at this point, I don't. However, what I did build into the laser is specifically to higher consciousness. I actually have a setting called higher consciousness, and I have a whole, protocol on how to use that to combine that with your meditation so that you can basically raise your vibration, right? Because that's essentially what we're trying to do when we're trying to meditate is we're trying to change our coherence. We're trying to change our vibration. And photons can very effectively help us to do that.
So I'm big on red light therapy, and I have a couple of LightStim Pro panels, one here at our wellness sanctuary and one at home that I use once or twice a day, and I meditate underneath it, and that's a really powerful practice for me. I know red light therapy has been shown to help with brain injury and healing. How does that compare to the laser therapy?
I use both. Let me preface it like that. I use both LEDs, I use lasers, and quite frankly, I'll oftentimes use an LED panel at the same time with a laser. So I love the use of both. We need to understand the difference between laser diode versus LED. There's coherence when we produce light from a laser diode. So the photons that are being produced are in the same phase and time, right? So that's big. And let me kind of break down what that means. Think about having a conversation with someone, and you can have a quiet room with no other distractions, and you can have a very clear conversation with that individual, right? You're both in phase. Okay. Or you can go to a very crowded conference room, very busy, very crowded, very noisy, right? If you go into the tech hall, right? That's more of like an LED experience where it's not in phase, it's not in coherence, right? So you can still have that conversation, but you may not be as effective at delivering your message to the individual that you're talking with. Now, I also describe LED and laser like driving a Kia versus a Ferrari. They're both cars. They're both going to get you places, but the Ferrari is going to get you there a little faster, a little more effectively. And so that would be the laser, where the LED is more like the Kia, and nothing against that. Again, I use both. The other component that's really, really important here is how you can modulate a laser versus an LED. And what I mean by that is if I want to be very specific and targeted with my patients or with myself, even at home, right? Then I want to be sure that I'm speaking to those cells or to those networks as specifically and targeted as I possibly can. And the example that I use is if I go in to put a baby to sleep, I'm not going to yell like, "It's time to go to sleep, baby." Like that that doesn't work, right? The volume of the voice is wrong, the cadence of the voice, the intonation, even if the words are accurate, everything else is wrong. And so the biological effect in that baby is not to go to sleep. So we can pull these levers in a laser while we cannot in an LED panel. And in fact, this was the biggest thing missing and a huge reason why I wanted to make the 528 Innovations laser is because I wanted that granular control over the laser beam for every setting. And so it's like I'm controlling the voice of that laser with every different setting based on what I'm trying to do. So I have a different duty cycle. I have a different pulsing frequency. Right. I can control this and not even getting into the polarization discussion, but so I can create a much more targeted and specific outcome by controlling those parameters.
As I say, the specificity and the target directly on what you're looking the outcome to be much more specific. Now I want the Ferrari in my home, Dr. Brandon
That's
Crawford.
right.
Are these devices that you believe individuals will start having in their homes? Like, what can we do at home that's similar to this, or is this something we need to come in and see you for?
No, so I developed this system to be strong enough for the clinic, but safe enough for home. The reason that I did that is because I've been working with patients for so long, and everyone, not everyone, but the majority of people, after they work with us, they'll say, "Can I buy that laser for home?" We did, and we would help them by writing, a care program and all this kind of stuff. But anytime they wanted to deviate away, like what if they wanted to use it on their spouse or their kid or something like this? They didn't know how to do it. They didn't know what to do. And so I wanted something, number one, that was safer yet stronger. So this never existed before. So I actually created a stronger laser, but it was actually safer. So it's class 4 power with a class 3R safety. So that's proprietary to our system. But then this laser actually has a whole app that comes with it, and it'll have programs which will walk you through step by step how to use it for certain issues. And then the presets will also have general use guidelines behind it. So the app really helps to solve the issue of I have this great laser, how the heck do I use it?
And what from what I've understood with the laser, if you target certain areas of the brain, it's going to have different effects. So is that something that's simple enough for us to do at home to know exactly what portion of the brain to hit with the laser?
Yes. So I have like a general brain health protocol. And what you do is you leverage the concepts of blood illumination. So I have people use the laser over the carotid arteries and then over the vertebral arteries, which is just behind the earlobe. And what you do with that, the carotids are going to go up and perfuse the majority of the cortex. And then the vertebral arteries are going to go up and perfuse the brainstem and the subcortical networks. And so by doing this, it's a very safe and effective way to influence the entire brain. You modulate blood flow, increase oxygen, increase BDNF to increase neuroplasticity. All kinds. You see all of that start to play out with this very simple and safe procedure.
This is such an incredible device and information I think many of us aren't aware of. I think very few of our listeners may have already experienced or used laser therapy to improve cognitive function, to improve potential past brain injuries. I'm curious for you, are there any other, like as an expert in this field, any other practices, daily habits, supplements that you recommend our listeners take or tune into to kind of optimize their functioning?
Yeah. So my big thing is get your light right. We're designed, our brain, our body, everything, our liver, our detox systems, everything is designed to go in sync with the sun. Okay. So we're designed to capture that early morning sunlight. That is the most important sun exposure of the day. The mix of wavelengths is magical and largely what we're missing in life. So get the early morning sun. If you're just trying to maintain health, 10, 15 minutes should be adequate. If you have a health problem, you may need to go longer, 30 minutes to an hour. If longer, if fine, if is fine. Of course, avoid getting sunburned. But then I also want people to get sun exposure at that peak time of day. So when the sun is at its highest peak in the day, specifically over the abdomen. This is a really important time of day. You get those longer wavelengths, they penetrate deeper, it helps the microbiome. There's a huge impact on light sculpting the microbiome and helping with gut function. And then I want you to experience the sunset. This is going to help start to produce melatonin, get you ready for bed. But the problem then is after the sun sets, people go inside and they blast their retinas with screens. And anything over 30 lux light intensity is going to disrupt circadian biology. And so you can literally download an app. I think it's still free. It's called Light Meter, and you can measure your light environment. And I have dimmers in every room. We have lamps everywhere. And so I keep my light environment below 30 lux after the sun goes down. If I do look at a screen, I have blue blockers, which are over there on my desk right now. So if I am looking at a screen, I do have blue light blocking glasses, specifically after the sun goes down. I will say from a supplement standpoint, I'm a huge fan of C15. That's fatty 15. Dr. Stephanie Van Watson found that essential fatty acid. It is directly correlative with health span and longevity. So the more C15 you have in your blood, the longer, healthier you're going to live. The other thing that I'm very much in love with is the product line called Stemregen. I'm not sure if you're familiar with it, but this product line is quite amazing. I've been using it clinically and then also on myself. This will actually increase your own endogenous stem cell production. So 2 capsules of the release product by Stemregen will increase your stem cell count by about 10 million on average. And so you take these, throughout the day, you increase your own stem cell count, you heal better, you feel better, you have higher energy. It's just a great health and longevity, plan of attack there. So I could go on. There's, 100 different things that we could talk about.
You are a wealth of knowledge. I'm wishing I had you for more time. I selfishly wanted to use our podcast as a consultation because what you focus on and some of the symptoms I've experienced are so relatable and connected. And so I want to maybe book that separately, but I'm also so interested in all the work that you're doing. I think you are providing so much value and changing people's lives in such a major way. So I really want to thank you for that. And I think our listeners can really tune into the healing power of light and how they can start using it to their benefit to increase their longevity, their health, their brain functioning. Even if they're not presenting with any certain conditions that warrant a doctor's visit, we can start paying much more attention to how light is affecting us on a daily basis.
It very much matters. We need to get the light right before we dive into all these other amazing things, but we still have to get the light right.
Totally. Dr. Brandon Crawford, is there anything you'd like to leave our audience with today?
We touched on a lot of different topics. I guess at the end of the day, I'll circle back to the concept of never accept never. If you're someone that is, whether it's, you're suffering from a chronic health condition that there's no answers to, or you simply just want to optimize your own health, right? Because that's something that not a lot of people really dive into. Clinicians were all focused on pathophysiology and all this kind of stuff. But what about the person that just wants to function better? Well, that matters too, right? So this concept of never accept never, when someone tells you you can't, you won't, this won't happen, whatever, just tell them to get out of the way. Thank you for your information, but get out of my way. I'm moving forward anyway. So mindset is huge here. Keep moving forward no matter what anyone else says.
Where can our listeners find you?
I've got a few different websites. So you can go to drbrandоncrawford.com. That's kind of an overarching website. It has my podcast and a few other things on there. My clinical practice, I have a practice in Austin, Atlanta, and Dubai. Practice that I'm currently at right now and am at most of the time is in Austin. So that's neurosolutionatx.com. On Instagram is a great place to see like patient testimonials and stay up to date with all the things. That's at B Crawford DC.
Wonderful. Dr. Brandon Crawford, thank you so much for coming on today.
Absolutely. Thanks for having me.